We're going to be talking about Jewish trauma and psychedelic assisted therapy with a focus on culturally informed care. We have a group of legends here that I'm incredibly honored to be sitting with, and I'll have them quickly introduce themselves before we jump into the conversation. Let's start with Ido.
Hi, everybody. I want to say thank you again for everybody that organized this. This is very special, and for everybody on this panel, it's an honor to do this really important and undiscussed, less discussed topic. My name is Cohen. I am a clinical psychologist based in San Francisco and also the founder of the Integration Circle, which helps people prepare and mostly integrates expanded states of consciousness. And I'm looking forward for our conversation.
Hi, my name is Julie Holland. I am a psychiatrist and author of books like Weekends at Bellevue and most recently Good Chemistry. I'm a medical advisor to MAPS and I'm a former medical monitor for a lot of the phase 2 MDMA PTSD studies and one ill-fated cannabis PTSD study. And I'm Jewish.
Hello, everybody. I'm Keren Tzarfaty. I'm the co-founder and the executive director of MAPS Israel. A trainer for MAPS, a supervisor, a therapist, and running the activity in Israel for MAPS. I'm also the co-founder of the Hakomi Institute, which is a mindfulness-based, body-oriented psychotherapy. Living in Israel, and I'm really happy to be here.
Hi everyone, my name is Esther Engel. I'm a feminist Jewish theologian. I did my training at the University of Chicago. I'm currently also practicing as a humanist chaplain at Mount Sinai Hospital. I'm a spiritual care provider to people of all faiths, though I have a Jewish background. And the last thing I'll say is I'm also a performance artist.
I'm Rachel Yehuda, and I am the founding director of the Center for Psychedelic Psychotherapy and Trauma Research at Mount Sinai. It's a new center, but for the 30 years before that center opened, I've been doing research in post-traumatic stress disorder, and in the early 90s, opened a clinic for Holocaust survivors and their descendants. And so I hope a lot of our conversation can center around how dealing with Jewish trauma may be similar to or different than other kinds of intergenerational and cultural traumas.
Thank you, everybody. And to our 200 plus participants tuning in, feel free to add in questions. We'll have a little time at the end to answer some of them. But let's start today with checking in on the state of psychedelic therapy, both in Israel and in the United States. What's going on? What's kosher? What's legal? What's it look like?
I can speak about Israel. Yeah. So we have lots of psychedelic research and activities in Israel. We have the phase 3 in 2 different hospitals, Sheba and Ber Yaakov. Very, very happy to run it and to have those really wonderful results. Other than that, we have research with psilocybin for treatment-resistant depression. We have an open access for 50 more people getting the MDMA for PTSD treatment. We have an eating disorder study starting with MDMA and psilocybin, and also a special MDMA for PTSD for soldiers that they are going through or went through a moral injury in their service, mostly in the occupied territories. And lastly, we're hoping to start something in Ramallah with Palestinians in the Center for Torture Survivors. So that's a little bit of what's happening in Israel.
It seems that in some ways Israel's is even further along than we are in the United States.
I would say yes and no. To some degree, we have lots of studies and support from the government. We are working with the mental health department in the Ministry of Health, and they're very supportive and in a real, I would say, hope to get some kind of well-beneficient treatment for PTSD. We have a lot of PTSD in Israel. It's something we suffer because of Jewish history and the political situation. So there is a real, I would say, wish to find a way to cure maybe or to heal this wound. Specifically, I don't know if you heard, but 2 weeks ago, a soldier with PTSD burned himself in the Ministry of Defense, saying that he's a representative of people, soldiers with PTSD that are not getting well treated, and that created a lot of pain for all of us and sense of despair in many ways. So I think as MAPS, we're coming with maybe we're still in the middle of the research, but we're coming maybe with another way of treating. I think psychedelics part of working with PTSD.
Let's define Jewish trauma. Rachel laughs.
You know, I'm sort of laughing too. My husband and I were talking about Jewish trauma and how through the generations, what qualifies as something to complain about has really, really changed. And that in my generation, I may complain that I didn't get a reservation to my favorite restaurant or whatever, or got, couldn't get the theater tickets I wanted or something. But my grandfather's complaint was that he had to gather all the bodies that had been chopped up and put them into one mass grave because Jews have to be buried all in one piece. So I just, Jewish trauma is relative, every childhood has trauma, even if you were born with a silver spoon in your mouth. Sometimes somebody wasn't paying attention to where that spoon goes, that they just weren't there for you. So I think there's Jewish trauma with all of us in every generation, but obviously those of us who've had family killed by Cossacks or by Nazis, the level of trauma is a little bit higher than, not getting your concert tickets.
Yeah, and I would add to that, Julie, I agree. I think when we talk about Jewish trauma, we're talking about really challenging and difficult experiences that are there simply because of Judaism or being Jewish. And so we Jews don't have a monopoly on trauma, but they probably care more about the traumas that occur to them as a result of being Jewish. So I think that's what we mean by that. And so the importance of saying that is that the lessons that are learned about Jewish trauma are easily adapted universally. It's just a matter of putting yourself in the mindset of how somebody else might also suffer cultural trauma or suffer as a result of being part of a society or a culture or religion or a race.
Yeah, I really like this question, and I like what you're saying, and I think I'm thinking about this conference about Jewish trauma is less about events, but more about like archetypes of displacement and persecution and homelessness, because there's been so many events in Jewish history that led to the same feelings. So I'm thinking about how it can be Ashkenazi, Sephardic, if you have ancestry from the Holocaust or not. If there is anything for me that we carry as Jews, there is this sense of displacement, of constant persecution and hypervigilance, home, that sense of like, what is home? Where is home? Is home safe? And also like this hyper reliance on intellect, because that's how we stayed safe for so long. That's how we survived for so long, and how that creates some kind of disconnect between the intellect and the body and the intellect and the heart. So I think about it less as, we can chase the events, but more about like, what are those core themes that are staying with us through generations, and how they still get expressed, like Julie said, after 3 generations of the Holocaust. I don't have to worry about being persecuted by Germans, but why do I still have to eat all the food on my plate? And if not, I feel really, really bad, right? And everybody's laughing because everybody knows that experience, right? That's true. So how does that archetype still stay alive inside of us and gets expressed generations later?
Yeah, I'll follow up and pick up on Ido's comment. I was really struck by this question. It felt like there was no way in, because it just feels like the collective field maybe we've all been raised in or brought up in. And immediately my response was, what is Jewish trauma? Jewish trauma is my body. It is literally my body, whatever I've inherited from both sides of the family. And then trying to like maybe put together some formulation of words, like what is Jewish trauma? I came up with a profound interweaving of collective histories, memories, of dislocation, wandering, displacement, the experience of being perpetual refugees, possessed by history, the experience of otherness, potentially being special, different, a pariah, troublemakers, the straw man for society's ills, and the scapegoat.
Mati, thank you for bringing us to the body too. I mean, Rachel's work is so focused on the biology, what's actually going on inside of our nervous systems, what gets passed on, how does it live inside of us actually. And you know, it's so wonderful to have this conversation with both Israeli and American perspectives. I'm curious, how is Jewish trauma different for Israelis or and diaspora Jews? Like what comes up around that geographic?
Are you laughing?
I sat like 2 hours last night thinking about those questions, and I spent the whole time thinking about that. There's such a big difference. I mean, for me, the main thing is I think I'm Israeli. I came here 10 years ago. You can hear it in my accent. And it's only being outside I realized that Israeli trauma, the Jewish trauma and Israeli trauma are combined, and they live in the nervous system. Yeah. Like I remember I always use this story. I remember the first time I heard there is an earthquake alarm every Tuesday at noon in San Francisco. And the first time I heard it, I was next to an Israeli friend of mine, and we both looked very vigilantly to the first window. And we then looked at each other and started laughing, but we weren't really laughing. We were very sad because it's like, I'm used to an alarm saying there's a danger coming, like very immediate. And it's still in my body. And it took me about 6 years to stop having that response. So, you know, I'm thinking Israeli trauma is living inside a very, very hyper-vigilant, always traumatized, high level of nervous system activity. And then, you know, you go to the army. So you add that on top of that. It's mandatory to go to the army. So if you want to or you don't, you're exposed to that experience and all the conflict that comes with that experience. So for me, it's like Israeli like trauma is sitting on top of Jewish trauma that's sitting on top of it. It's like a sandwich, like a trauma sandwich that gets created there. And how do you even start to tease those out while you're living in it? I'm curious what I think that's the big problem. As long as you're in Israel, it's really hard to suss that out. And that's why I think psychedelics are so can be a beautiful healing method. Like Keren, you said, there's so much PTSD in Israel. It's everywhere.
Yeah.
But it's normalized.
Yeah.
Go ahead.
Just hearing you, just interesting. And also I totally understand what you are saying. And I have the same, you know, I lived in the States for many years, and I went through this process of letting go of some of the fears and the tension in my body and heart. And I would say that the way I see it, that there are maybe 3 different kinds of trauma, of Jewish trauma. The first one is just fear of being harmed because of being Jewish, or fear of physical harm and death. And I'm thinking about pogroms and the Holocaust, and really being scared about my physical safety. Yeah. So that's one trauma that is very, very experiential. And Mati, when you say it's in our body, I totally agree. I think it's in our body and in our muscles and bones, but it's also in our emotional body and in our energetic body, in our mind, the way we think, our cognition. So that's one trauma that I think is very common. The second one is related to experience of being a minority. Yeah. Just not having the same civil rights or social rights, or being a scapegoat, as some of us said, and being blamed for different things. So it's more like in a cultural, social, civil rights context. And the third one, I would say, is more around the wandering Jew, or being an immigrant or refugees and having to run away. So I think those 3 that are mostly, I would say, common experience to Jews. Like I think all the Jews in the audience or here kind of know what I'm speaking about in just a very basic level of experience. And some of those things are very alive in Europe or the States, or so it's not an old trauma. It's things that are still alive. But in Israel, all those 3 are having a little bit of different colors, although they're still exist. But so the physical piece, the fear of death, is very much kind of being repeated by the Middle East energy, or Israel being in the Middle East and feeling threatened, the old wars. And I'm not even going to politics, who's right and who's not, just having conflicts that are physical and violent are just bringing this fear of death experience and fear of being harmed, and the same kind of repetition compulsion that Freud talked about, is just experience again and again those core beliefs of we are not safe and people don't want us to live. Or yeah, so the Holocaust, with every political argument in Israel, when you start talking about wars or left and right, you go back at some point to the Holocaust. It's so basic. So I would say that's one piece or one kind of traumatic experience that is very alive in Israel. But with the minority or civil rights or cultural trauma, we have it in a very different way, because we're not a minority. We are the majority, really, right? And not to say that some of us, women and Sephardic and Mizrahis, are definitely having similar experiences like in most cultures in the West, but it's not because of being Jewish. So in this sense, we have a very safe experience. Being Jewish is a safe thing in Israel. And for me, going back to living in the state, it was a very interesting new experience to be a minority and to look at from just having different kind of power in Israel. Although I'm a woman and although I'm a Sephardic woman, I still feel much safer being a Jew in a Jewish country. So I think in this sense, Palestinians in Israel, or Arab Palestinians, Israelis, Arab Palestinians, whatever, there are so many definitions, they have a similar experience to what we experience as Jews in the state or in Europe. And just maybe one last thing to say, that in Israel, most people, I'm first generation in Israel. My parents came from Bulgaria. And I think most of the people in Israel are first or second generation. So the whole country is having this immigration experience that is usually very complex.
I wanted to piggyback on what you're saying, Keren, because I think this is a session where we're also trying to provide guidance for people who are working with patients that might be experiencing Jewish trauma or intergenerational trauma, which we can all talk about our own feelings. But I think it's really important to talk about the purpose of why traumatic experiences do live in the body, and why we do have a physiologic signature that kind of reflects not only the way we are hypervigilant about the world, but that also might be transmitted as a legacy for how our parents or our grandparents have been in the world. And I think that one of the ways that it can be reframed for patients is that these kinds of legacies of trauma are meant to be tools that can help us better adjust to what is going on in our environments. The reason it's such an important question that you asked, Lauren, about the difference between America and Israel, historically, although things are changing in America, Israel used to be a place where there was a lot more active threat. And in America, Jews could kind of blend in a little more, maybe, certainly if they wanted to, and not be the direct targets of Jewish trauma. But I think that if you go back and think about trauma as a version of extreme stress, we have an entire neuroscience literature that is about stress. And how do you study stress in an animal? How do you study memory in an animal? You stress it. So I think what's really important is that when you understand stress and traumatic experiences as intertwined with memory, then you begin to get a certain really important context for the fact that we carry these signatures of trauma as part of our mandate to kind of remember and learn from the past, and learn from the past as a way to also have tools towards a better way of responding in the here and now and towards the future. So that really, that's why in Judaism, we are focused on remembering the past. We're not remembering the past around the Seder or any of those kinds of events. in order to traumatize ourselves. We're doing it to reflect on our resilience, on the fact that we have tools of survival. And so when somebody comes and really reflects on all of their traumas, layered upon traumas and traumas and traumas, it's really good to help unpack some of that as being related to the ability to survive and resilience, and really questioning whether the experiences that we're dealing with in the here and now are continuation of something generational, or whether they reflect different challenges that we might not be coping as well with. So I think that that's a really important pivot in terms of just helping people with that, because people tend to feel that they're loaded. You talked about the sandwich, but people tend to feel that they're not just walking around with their burden, they're walking around with the entire burden of history. Maybe what they're walking around with are also the tools of survival from that burden of history. And that might help people in the reframing.
I really appreciate you saying that, Rachel. And I think that's why, I love this whole conference and this panel, because I think psychedelics is what helps tease that out.
Yeah.
Until, so like, right, what I experienced is like the oppressing part of that memory, of how I still feel like I carry all those wounds and all those pain and all that, and move towards how it's actually resources and the beauty and reconnecting with, right, Jewish soul and Jewish faith and Jewish strength and all the beautiful colors that has. And it's really hard to tease out sometimes when you live inside that narrative, or your family really lives inside that narrative. I mean, one of the things that I'm really curious about as Israeli coming here is, I don't experience what Keren is saying. I don't experience Jews experiencing themselves as a minority here. And it's baffled me. I'm like, you are a minority. Like, where did that experience go? Like, how much of that is tied to assimilation and dissociation and, the perpetual feeling of being persecuted, right? Not just in the 50s and 60s, what happened here in Jews, but I know Jews from who 15 years ago had to felt that they have to iron their hair. Now they have curly hair, so you don't get you got mocked or something like that.
Right. I think you said something so important. It's not about being a minority. The point that I was really trying to make before is that there's no learning without stress in animals. There's no learning and knowledge without adversity. The way that we were talking about this yesterday, when we were discussing some of the things we learned yesterday in the conference, that the body actually has a different pathway for the memory of distress and the memory of something positive, because the memory of something positive doesn't turn into a life or death situation or a need to know. But the memory of something negative has to be encoded in a certain way so that it won't happen next time. The fallacy of forgetting about trauma, and probably Judaism intrinsically understands this, is that you also forget the knowledge and forget the wisdom and have to kind of start from scratch each time. And I think if people can really walk around feeling that these epigenetic changes and these molecular changes are body armor, because I really believe they are, and incorporate them the way that we heroically remember all sorts of historical events, from the destruction of the temple, you name it, we remember it. We don't do it to self-flagellate or to become mental health casualties. We do it because they're just profound reminders of our ability to live through anything. And I think for somebody who is suffering, that can be a very good, gentle reminder in a therapeutic context. If you're the Jewish therapist and someone's talking about a Jewish trauma, you can get really triggered and wrapped up into that. So it's particularly important, that's monitoring the countertransference. It's still an issue. It's very important not to get sucked in. Yeah, I feel that too. It's very important to just remember that you're helping pull someone out of the quicksand, not having them pull you in. So it's just a good thing to keep in mind.
So I think, one of the ways that psychedelic assisted psychotherapy is so special is that it really does have the capacity to extricate the memory which we need from the, fear and pain and armor that's not serving us. Jews definitely want to make sure that we, every year we talk about Passover. Every year we reenact the Purim play. So we're very big on reminding people about what we've been through, and the memories are important. But the whole idea with MDMA assisted therapy for trauma, or psilocybin or ayahuasca or any of these things, is to maybe just try to change the emotion around the memory a little bit. You don't have to, it's not like you're going to come out of that saying this didn't happen or this didn't happen to me. Yes, it happened, but you're going to have a little bit more space around it. You can integrate it a little bit better. And I want to say one thing about cannabis, because I always love to remind people that cannabis is a psychedelic. Don't forget, I'm a Jewish person reminding you about facts that you need. Cannabis is a psychedelic. At higher doses, THC does hit the 5-HT2A receptor, because there is a dimerization between the cannabinoid receptor and the 5-HT2A receptor. Anybody who's had too much of a pot brownie or whatever, there is a distortion in your perception and your time. Anyway, the reason why I want to remind you about cannabis and psychedelics is because I also think, for me, for instance, I'm not a temple goer. I don't go to temple very often, but a few years back, I managed to be in a temple when I was experiencing cannabis, which somehow I missed in high school, maybe in Hebrew school, but not in temple. So, but I was, for the first time, really kind of, felt the power of everything in the temple. And, I would just like to remind us that this potentially is a way to combine maybe microdosing or not macrodosing, but there may be a lovely museum dose where you can really connect more with the ritual, with the music, with the feeling of community, in the sanctuary, which is lovely. That can be therapeutic.
I guess I want to respond to Rachel's point, and also Julie, just tease something out there. On the one hand, it seems like there are tools that we have gained, tools for resilience that we have gained from experiencing or inheriting trauma, Jewish trauma. But then on the other hand, maybe some of those tools no longer serve us, and if anything, are working against us. And so the way that I'm entering this discourse, like what is psychedelic therapy within the context of Jewish trauma, I think of it as like a new tool. We need new tools because some of our tools are no longer working. Whereas perhaps like a tool in the past was disassociation or like intellectualizing events in order to exist in a traumatic environment that the body could not ingest, digest, do anything with. How do we get back into the body now that we're so good at being in our heads? And perhaps psychedelics, specifically psilocybin, allows for that coming back to home. But I do want to add another thing there, is just that I've been, I name myself as a feminist Jewish theologian, but as a practitioner, I'm actually a humanist. I think that there's a lot of work of self-undoing or unselfing that, from my perspective, needs to happen for me as a Jewish practitioner. Before seeing any Jews and like holding space for Jews in their healing, I want to hold space for every other ethnicity, culture, religion, in order to take the Jewishness out of the front and center of my way of seeing the entire world, which is, I think, a very Jewish mindset. And I want to question that. I want to bring that to the table and say, is that serving us? And might we need to do some undoing in order to do the redoing or self-inhabiting, if that makes sense?
It makes a lot of sense.
Go ahead, Keren. Sorry.
Yeah, you sure? I'm happy to. Yeah.
No, I want to hear from you. I'll jump in next.
Okay. So just Maddie, when you speak, just one thing that comes to my mind, that I think the wisdom or the power of psychedelics therapy in terms of Jewish trauma or Jewish identity in general, that if we actually letting ourselves with MDMA or psilocybin or any other psychedelic to experience trauma and to have it again relived in a contained set and setting, in a safe place, and really process those emotions that got stuck and created the armoring that has so much wisdom, so much intelligence, old intelligence, but really there is a real question of how can we choose when to use it and when not to. So to use the intelligence and to remember the wisdom of it and how it helps us survive, but at the same time, now it's many times it limits us. So I think psychedelic therapy allows us to really experience the armor itself, with the difficulties, with them, the difficult emotion, with the narrowing of who we are, and really let go to some degree. And one thing I think that is also very meaningful in psychedelic work is that on one hand, it allows us to kind of experience our Jewish identity from a not from a religious point of view or experiential place, but from a more spiritual place. So we are, at least for me, I got reconnected to Judaism and to its wisdom and creativity and love from a place of clean spiritual experience or mystical experience, which made me feel much more at home with my Jewish identity. And on the other hand, it also made me question my very strong, I would say, identity or attachment to this identity, yeah, and allow me to really know myself as human being or as a citizen of the world, of all religions and of all, you know, humankind, versus just being in my Jewish identity. And again, having a choice of when to go back home or to this Jewish home and to really celebrate it, and when to become something that is wider, bigger, and deeper than just one identity. And that allows me, I would say, to connect to other religions and other people and different kinds of being from a healthier place.
Judaism and Jewish people are not a monolith. I'm hearing a lot of like nuance and how, you know, Ashkenazi Sephardic experiences can be different. The traumas can be different. As an American Jew, I was teased. I was not in a Jewish community and I did not feel safe with my Jewish identity. And in Israel, like everyone's Jewish, or at least that's the mainstream. So there's these kind of very important differences and details. And when we're in therapy, those details are front and center and they get to matter. And as a psychedelic therapist, I know that when we're opening consciousness on purpose, we're also working with intergenerational, transpersonal, and collective content. We're working with some of the stuff that comes well before us and maybe in, again, our bodies. I'm curious, what does culturally informed Jewish care mean? And why is it especially important for psychedelic therapy?
Well, you know, you could say that about any kind of culture. So Jewish culturally informed trauma care is an awareness that on top of everything else that the client may be experiencing or the patient may be experiencing, they may be the child or a grandchild of Holocaust survivors, or of people that have run away from pogroms, or they may have relatives that were lost in battle defending the state of Israel, or any number of those kinds of things. So somebody might come to you, for example, because they're in the process of getting a divorce, something that has nothing to do with Judaism per se. And yet, if you know something about them from a Jewish perspective, what does that mean to them from that perspective, about where family is so important, or where survival might be so important, or where one doesn't seem as free to make choices for their own pleasure because of all the expectations around how they should live because someone else suffered and died in the Holocaust, so that you have a burden for carrying something forward. That's that's Jewish trauma-informed care. The mistake that people make as therapists sometimes is they take what the patient says at face value. We're taught to listen very carefully to the words, but Jewish trauma-informed care is listening to the music. You're not going to hear it in the lyrics. You're not going to hear it in what people say, but in who they are. Where did they come from? How many people ask, so tell me a little bit about what country your grandparents were in. that can really make a difference, even if the issue is a very here and now, seemingly universal issue. And again, if you're a therapist, you would do this for somebody who was in a different culture as well. You would try to get a sense of who they are above and beyond the in Hebrew we say dalit amot, the four corners of just what they're presenting you with. And that can be a very riveting conversation. You can't really work with that so much therapeutically without psychedelics, because then, somebody comes to you with a problem of divorce. You don't want to be all over the place with too much other stuff. But if the intention is going to be trying to hold space and process events that explain why you're having the kind of reactions that you're having to events, or if the possibility of psychedelic work becomes apparent and available, that's when you're going to want to know what kind of legacies may be present and may provide the opportunity for integration with kind of familial, ancestral, cultural, and spiritual lines.
Yeah, I think for me, go ahead, Karen.
No, go.
Yeah, I think for me, it's, being aware of all these deep, unconscious, like archetypal conflicts we talk about, like the homelessness, the feeling unsafe, feeling displaced. Because those things can come up a lot in psychedelics, but in a very symbolic way. And I think if we're not really informed, we can literalize them. It's like, oh, it's a problem of this person, right? They're like, oh, maybe they're a little paranoid, or maybe as opposed to like, you and I talked about it, Laren, or maybe they're actually channeling something that's from their caring for the collective unconscious for generations. And also and I think for me, that's really important because there might be a lot of emotions that haven't been expressed in their lineage, like rage or terror or sadness or something Jews are bad at, which is grief. We're really good at mourning, but we don't know how to grieve. That's my opinion. We stay like, right, because grief has to do, and that's for me the other piece, which is also because grief has to do with letting go and individuating. So you can keep it, you choose to remember as opposed to you have to remember, right? In Israel, in every Holocaust days, you have to remember as opposed to choose to remember because it's important. So making that connection and really being able to listen and work with those things in a very open, symbolic, and curious way, as opposed to just literalizing it or pathologizing it, which is even worse. I always love to reference. There's a study that they did in Israel a few years ago where they found that grandkids of Holocaust survivors who've never heard about the Holocaust would dream their grandparents' experiences, which for me is mind-boggling. Right, but if I'm not aware of these things, as a practitioner, and someone comes in like, oh my God, I'm seeing myself, in the Holocaust, and you're like, oh, you're just right, this person is being paranoid, or they're just having a bad trip, as opposed to like, oh, like Rachel said, can we be curious about your ancestry? Like, is this something that is familiar for you from your family? Or maybe like on the opposite, maybe your family wasn't the Holocaust and never been discussed about. Can we hold that too?
Yeah, I love what you just said. I think that also what's a very important Jewish thing is this concept of, and I'm seeing it in the chat, of the chosen people, that we're chosen somehow. And I think that can really interact in quite a negative way, quite a maladaptive way, I would say better, with current life issues, because it's sort of a magnet for what are we chosen for. And when you're not in a good frame of mind, you will interpret that as being chosen for all sorts of adversities and really to have a pile-on. And so I think that is actually a struggle for people, that concept. And what Keren said also, just this fight to be special and universal. You want to be a chosen people, but you want everyone else to be chosen too. It's, I will confess, my husband has changed the kiddush on Friday night. He does not like to say kivanu vacharta mikol ha'amim. You chose us from all the nations. He changed it to im kol ha'amim, with all the nations. And so it after psychedelics, you can't say that. It's hard to say that. It's hard to be chosen in a non-universal way. You can only be chosen as special in the way that everyone is also special. But I think people really struggle with that in terms of the issues they bring into a therapeutic context. And I think this is the one place where psychedelics can really make you special and of this world and not apart from the world, which I think is a huge Jewish dilemma in 2021.
There's a couple things in the chat that are sort of funny. I mean, one was like, chosen, yes, chosen to suffer, somebody's grandfather said, which brings up two issues. I mean, one is, you know, Jews using humor as a defense, which I'm sure has been talked about into the ground, but happens. I've been known to use humor as a defense. But then the other thing is this idea of anti-Semitism and sort of the self-hating Jew, you know, that you've interjected society's ideas about Jews so that you may not feel chosen. You know, you may have projected self-hatred or not even projected. So just thought that's worth mentioning.
Yeah. I would also say that as a therapist, I think it's really important. Rachel, you said listening to the music, and I would just add listening to the music of the family, of the culture, of Judaism. And when we hear the story, to deeply listen and sense and feel not only the words of the story, but the storyteller, and the storyteller of the family, of the culture, of Judaism, because this storyteller has a specific kind of assumptions. Like, I'm chosen, I'm not chosen. What does it mean? I'm guilty in something, right? As Jews, we like to be guilty, to feel guilty, or just different core beliefs and different assumptions that are not necessarily aware at all, but sub or unconscious. And as a therapist, I'm listening to this melody too, the wider melody. And Rachel, I was working on Agada for Passover. I was changing the whole thing. I have my own Agada now, which is like no violence, no being chosen with the different nations. And because for my kids, I want them to get a different kind of music. I want the music to be a humble music, a deep music. So I'm trying to choose, and I know it's maybe not at least in Israel, it's not very common, and there's a lot of criticism about that. But I think the cultural, the social assumptions or core beliefs are very deep, and they can really deeply influence our internal experience. So it's good to listen to them and to be aware of them as much as we can.
I'm going to jump in here and just like trying to figure out how to, work with all the pieces. But I'm hearing like this struggle maybe between, holding on to like a loyalty to history or a loyalty to word, to text, which might relate to Ido's comment about how he finds that Jews have a difficult time grieving. Maybe it's that we have a difficult time letting go. But actually we're quite good at grieving. We're too good at grieving. At least that's my experience. And so the theologian in me is saying, how do we make our text more expansive? Because as Rachel Yehuda was saying, I also feel like a knot in my stomach when I say Kiddush, Asher Bachar Banu, or even Aleinu L'Shabach, like you chose us from all of the nations. It's how do you say that in the 21st century? How can you say that as a modern Jew? And what do you do with that loyalty to history and loyalty to word, loyalty to text, which I think is a form of love? And then as a practitioner, like working as a chaplain, what's coming up for me is like the experience of being like a gatekeeper or like kind of like at the crossroads between the institution, a hospital, Mount Sinai, and my patients, being a patient advocate. And when I interact with my Jewish patients, I'm just like, you're like, there's a part of me that's like, you're my family, and therefore I want to go the extra mile for you. But then I have to keep that in check as a practitioner. I have to serve everybody equally, even though I share the same language with you. And I might even understand that the reason why you're being so pushy about extending visitation hours during COVID is because you can't You can't bear to think that a stranger will take care of your husband because you do not trust them. And you have every right not to trust them because all of the medical practitioners are burnt out. So it's like being in that in-between, in that crossroads of like, I am a practitioner of spiritual care, but I'm also treating Jewish patients and non-Jewish patients. And what selves am I bringing into the room? What loyalties am I bringing into the room? And what maybe, and this speaks to, I think, Rachel, Yehuda, what you said, like, once you have a psilocybin experience, it's kind of like you have to be of the world. Like there's a way to inhabit the world. And that question of just loyalties and what is grief? Is grief holding on until the very end? Like this fierce, like I'm not letting go because I am going to cry every tear because that is love.
I love what you just said, Mati. I think that what's very scary for people is also feeling disloyal to being Jewish, and to there is a certain fidelity that is ingrained in the Jewish people, however you practice, to really be within the bounds. And the beauty of an ineffable experience like with psychedelics is that you can hold two seemingly contradictory truths. One is that you're of the world and global and universal, and that you are intrinsically profoundly Jewish. And I think that, that's what people really are struggling with a lot, as they want to be profoundly and intrinsically Jewish in a world where they can also have universal value and cherish everybody else just as much. And they just don't know how to work that out. And at least, I found my psychedelic experience profoundly powerful because half the things that were running through me were Jewish things, biblical things, songs, sayings, phrases. I agree with you. Somebody made the comment about Aleinu, and just in this world, it's very hard to say a prayer that disparages others. It's not very woke, and it doesn't feel good. And it almost feels like you're doing exactly what throughout Jewish history we have resented people feeling the privilege of being able to do. So I think in terms of kind of cultural global healing, if done in the right frame, and this is important, if done in the right framework with the right container under the right circumstances, then psychedelics offer something pretty powerful if those are the issues and those are the struggles. But I want to be really careful about it too. We're having this conversation at a time when psychedelics are not yet legal. And, it's the elephant in the room that I just want to say, and we might all have feelings about whether that should or shouldn't be. But I think that that's also a fear that people have, because a lot of things that have been used to justify anti-Semitism, and in fact, extermination of the Jews, is when Jews didn't follow rules. That certainly happened in the Holocaust, unfair rules to be sure. But I think that how can that not exist as an archetypal epigenetic memory or kind of a backdrop? And I know that later on today, there's going to be a session about why legalization is a Jewish imperative. And, maybe these things will be picked up. I just agree with abolish the prisons completely. I just saw that on the chat. It's not consistent with public health. But I think that there's so many little nuanced things that goes into people's fear and people's reluctance, and that we have to be very sensitive to what it means for somebody maybe to break a rule. And maybe this is somebody that has decided that they are feeling very constrained by the rules of Judaism, but yet on this other hand have this deep fear of what is the consequence of breaking a rule, because that's so ingrained in biblical text and culture too. So how do you give someone permission to self-actualize and express from a Jewish perspective? I think we have so many things that we are holding for people as we help them figure out what the best avenue towards healing is.
And yeah, I want to piggyback on what you said, Rachel, and you said, Julie. I'm thinking about your question, Lauren, as far as like what's culturally informed care. And I think specifically in the US, and I'm curious if people have thoughts, is there is this, I as an Israeli observe a very, there's legitimacy for internalizing anti-Semitism and anti-Semitism in general. Like I've never seen so much anti-Semitism happening without no big upheaval or talk about that. And I've always been curious to see how, like talking to Jews here and see how it lives in people's like personal identities. And I see Jews that are very ashamed and totally dissociated from their Judaism, not because they want to be, but because it's internalized and they're not aware that it's internalized, because there's still that danger, or there's still this idea of if I be that, what will happen? So I'm wondering, yeah, I'm thinking about as far as culturally informed care, like that's going to be a big one as far as when psychedelics get legalized, and there is maybe a more like movement of Jewish informed therapy. It's like, yeah, how do we work with anti-Semitism when it's so tied to the collective conversation? Or
Because
I think in
we have
America,
to work with anti-Semitism as a form of self-hate can also be tied with
exactly,
anti-Semitism, and anti-Semitism with self-hate. And if you're working with somebody that is complaining about anti-Semitism, that's a wonderful place to take it. And it might be too hard to do in a sober state, but it's probably a very easy place to get to in a transpersonal state. However that is achieved, but let's not miss that a lot of real deep self-inflicted criticism and lack of self-compassion and harsh critical self-judgment and even self-hate, can sometimes be spoken of from a distance as anti-Semitism, as if that's the problem and not all these other things that are going around. So it's just part of the whole thing. And the reason it's important to be so specific about it in a Jewish psychedelic forum is because of the countertransference issue, because it's something to keep in mind, because it's easy for the therapist too to say, yeah, anti-Semitism, that happens to me too, without kind of redirecting it back to the person in front of you, and kind of keeping your Judaism and your own experiences and your defenses at bay. So it's a lot of work.
And each Jewish person has their own relationship to their Judaism. And I'm curious how psychedelics support the trauma sometimes created by connection or disconnection with Judaism. And if we could speak to people leaving religious Judaism, reconnecting with their Judaism, and also healing the rejection faced by many patrilineal Jews.
I'll pull a one-liner. I think sometimes you have to leave in order to re-enter. And it feels like something, I mean, we talk about culturally informed Jewish care, but it's almost like it's so patient specific. I mean, like, what have you inherited? Like, what histories have you inherited? What belief systems? What loyalties? And what restrictions? I mean, I think about it a lot from the gender perspective, actually. And to some degree, I can share somewhat personally. Like, I came from a lineage of Holocaust survivors on one side coming from Hungary. The other side was Tzarfaty Jews from Uzbekistan who had to travel to Pakistan, Afghanistan, India, to Israel, and then to New York. Also religious oppression, but women and women's intellect being kind of like boxed or stifled, and then what that ended up doing in terms of, unraveling like the family, and the safety of the home. And from my experience, it's been, in order to re-enter or engage with Judaism, some people have to leave in order to come back.
I totally agree with you, Martina. I was listening to the conversation before us about why so many Jewish people go to India. And as someone who's done that route, there is, I think, there is something about, we, use the word patriarchal, but I'm thinking about patriarchal. We have to get out of that punishing God. You have to be Jewish. You have to be Jewish this way. There is a right way to do it. Right? All those oppressive systems that live inside any religion, to find that peace, to find ourselves, and then find like something that Keren said in her own experience, and I found it for myself, like to find my relationship with Judaism, not what I was told should be my relationship with Judaism or my Israeliness or anything. And it's very, very easy to say, but very, very hard to do. There is so much, like you said before, undoing. So I call that disintegrating that has to happen, which is very threatening to our sense of self. Like we really have to disintegrate what we think we've been taught about being Jewish and being Israeli and whatever that means, and go through that really scary liminal space of like, I don't know who I am in that regard. And that's okay. And now I'm going to start figuring it out.
Mati, sorry.
No, go ahead, Rachel.
Mati, what you said was so profound. We're planning a study in our center for intergenerational trauma. You know about it because we talked about it. And we were really debating whether to keep it to intergenerational Holocaust trauma, for which we could fill up a study, or to sort of broaden it to racial trauma. Because especially this year with COVID, I mean, it's been really on everybody's mind. And the one thing that you said that just struck me was that Jews can leave and come back. And a lot of people that are experiencing racial trauma cannot escape being Black or Asian or any of those things that really are part of who they are. And I think that in a cultural context of Judaism, I think Jews wrestle with whether or not their Judaism is stuck on them just like so, or whether they are leaving and coming back. But I mean, it's really a profound thing to think about, whether you really can leave and come back, and what that means when you absolutely can't, and what do you do with that? So I just don't have an answer for that, but I just thought I'd throw it out.
Yeah, I want to jump in and just to tell you a story about one of the participants in the study that kind of went into something I think is very typical to psychedelic experience, really being in the unknown. And Mati, when you say living Judaism, that was the experience, kind of living the identity, living the knowing, living the words, and just being in an unknown. And in this mysterious experience, the words of the Shema came to him. Shema Yisrael, Adonai Eloheinu, Adonai Echad, and he really experienced them, the words, from a very new perspective. It was not the automatic kind of, okay, it was just about the oneness of all things, the Echad, the oneness in Hebrew. And there was a profound mystical experience that really, he re-entered Judaism from a different place, in which he was very much connected to oneself, but also to the others, and the idea of tikkun olam came to him from this experience. How he and the rest is one. So taking care of himself is taking care of everybody. There was something just in the sentence you said, living Judaism in order to re-enter, that was very profound there. And I want just to emphasize the very important place of the unknown. We are living to the unknown. It's not, we're living the known words, ideas, identity to the unknown. And there in psychedelic, we can find new everything, really. Yeah.
One more question before we shift to questions from the attendees. How have psychedelics been shown to help people overcome intergenerational or race-based trauma, such as Jewish trauma?
So there's no empirical evidence where that was a question that was studied per se. We are going to do a study to answer that question. But anecdotally, I think people who do research as well as underground therapists will tell you that there's almost never a journey where something doesn't come up from the experience of a parent or a grandparent. Um, what generally happens is what is so important for intergenerational healing, which is that you find compassion and forgiveness for something you've been resenting that was a fallout of something that a parent or a grandparent suffered that then kind of landed on you, and that you can see from a different perspective, from a kinder, gentler perspective, that maybe they didn't have a choice, or maybe they did the best they could, or you just approach it not just from the me, and how it influenced me perspective, but you can really hold the suffering in in um, in a way that's not affecting you in that moment, but that's all about comforting the parent or the grandparent, or having a profound understanding that helps you know that you can be okay, that it's not just from your perspective. So I think that that's anecdotal. And so then the question will be, how do we design research that will help us tell the truth of that? And so I think, I welcome comments on that. You can always tweet me and all that, and do it. We're currently constructing that study. But the reason it's such an important thing to do is because a lot of the outcomes right now in psychedelic research are about symptoms: depression, anxiety, PTSD. And if we want psychedelics to be a tool for healing of trauma and intergenerational trauma, the outcomes may not be reducing symptoms. There may not even be symptoms to reduce. The outcomes may really be along a very different dimension and spectrum, such as developing more compassion for people in your home or your families. And so, and also the idea of making the pivot from a psychedelic treatment that might be FDA approved and that you might get when you go to your psychiatrist or your mental health worker, versus just this idea that you need healing, even if it's a very non-specific set of psychic wounds that you are suffering, but you just know that you need the healing. And so it really behooves us to think about these outcome variables. And I think it'll really be helpful if we can do that.
And just adding to the anecdotal data from underground and therapists that are reporting, and from the studies, we also hear that the connection itself, just feeling connected to the mothers and to the grandmothers and to the grandfather and to the children that will come or already here, to Judaism or to the Jewish people, through the suffering and through the resilience and the beauty and the common sharing, that by itself is very much meaningful for people.
Yeah, I think I would just add that it really triggers a new sense of awareness of how that lives inside of me, in my psyche, in my heart, in my soul, in my body. And it gives an opportunity to separate, to create a way in which I can see it and I can see myself and re-examine that relationship and create a healthier relationship, right? I don't have to finish all the food on the plate. Like that doesn't go. I always use that because it's both funny, and I have a friend who we always laugh about that because she still does it and she's very aware. But I think it becomes a relational cure. I think that's the point I'm trying to say. It becomes a relational cure. It gives us the opportunity to actually have a healthy, authentic relationship to our narrative, to our history, to our faith, to our religion, as opposed to just being merged because that's what we grew up into the narratives, into the conscious and unconscious, the spoken and unspoken.
Many of the studies now, both in Israel and in the United States, are working with individuals in closely monitored and controlled clinical settings, of course, to get research. And a participant is curious, how might these healing modalities scale to include group work, and what might the future of facilitation look like?
We're going to do a group study. I think that especially for people that are not very, very symptomatic, group work it can be a profound experience. And also the idea of how to have a therapeutic regimen that combines both. So they're very different experiences. And in a group experience, the energy of what's happening with everybody is very present in the room. It's not a time to just focus on you, but sometimes that's exactly what you need, to not focus just on you. And sometimes you do need to focus just on you. This has been brought up in terms of scalability of psychedelics. That's supposed to be the selling hook. But when we do it, even if you hear me say it, I'm just doing it for marketing. I don't think it's about scalability at all. I think the group experience is a really valuable experience on its own, because isolation is such a big problem for people, and being in your own head and not really being able to connect or relate to someone else. And so the idea of coming together and everybody in a transpersonal state and really kind of using that collective energy to understand that even though there is a boundary of your body, there might be fewer boundaries in terms of the shared collective consciousness. It can be so healing and let people and leave people feeling much less alone. You do a psychedelic journey with someone, you can't hate them afterwards, which is why I love the MAPS study of doing ayahuasca with the Palestinians and Israelis. I think there's just no way. Even if they vomit all over you or whatever is going to happen, you're connected in a profound way. And I think for some people, the scars that they carry that is Jewish trauma informed has to do with feeling so beat up and isolated as a result of that, that I think this can be just wonderfully healing. And I hope that people don't just talk about it in terms of scalability. I hope people can talk about it as a truly powerful experience of coming together, Shevet Achim Gam Yachad, I think it's really something like that. To translate that, brothers who come and sit together as one.
We are also starting a group therapy study, but we will start from having them experience first individual MDMA, so they get ready for, or they get familiar with a different state of consciousness. And after 2 sessions of MDMA by themselves, we'll bring them to the group. And the intention there is I heard the phrase, which I love, is undoing aloneness. So to really let the trauma be heard and seen in a safe place, in a regulate experience, and to hold it together for each other.
Rosalind Watts, who was part of the work done at Imperial, she saw what they were doing psilocybin studies with people with depression, and a lot of people got better. Some people really got better and then kind of fell apart and went back to their baseline and didn't do very well. And when they followed up on those people, it really had to do with them going back to their own homes and their communities and not getting the support that they needed. So this idea of doing group work, you now have sort of a way where people can stay integrated, not be so isolated, be able to process what happened and stay in touch. And Rosalind Watts has been working at this retreat in the Netherlands called Synthesis, and they run like 8 people at a time in the group. And then this group stays in touch, and they continue to support each other. So yes, scalability, yes, efficiency, but obviously community is important, and feeling part of a group is important, and feeling like you can help someone else too, not just that you're getting help, but that you're giving help. I mean, that creates meaning, which obviously is important to keep going.
And I'm going to piggyback on what you said, Julian. I think that's where my passion. I think we want to extend that to the integration. It's how do you keep doing the integration work? Because that's where this is where we expose, and that's where the real change. And I can only imagine what would it be to do the same group who sits in that ayahuasca study, do the integration together in a group. So you can really confront those feelings that, right? Because you felt intense love for this person who is the total the enemy on the session, then all of a sudden you come back and you're having those old thoughts. How do you confront the old and the new in front of that person, not just in yourself in isolation? And also the really strong normalizing power of doing that in group, right? Where you hear people have the same thoughts as you, feel the same feelings as you, which you alone feel so much shame and guilt and even hatred toward yourself that you're having them. And it takes then that normalization. I've seen it because we do groups every month. I've just seen it help people have breakthroughs because they move from shame to curiosity. And that's a huge transition when you can sit in a group and be like, oh, everybody has that feeling. I don't have to be ashamed. I can now work with it. I want to work with it.
It's the most Jewish thing, Lauren, because think about a minyan, think about a quorum, think about the fact that half the things that one can do in Judaism don't count without a critical mass or a quorum of people. I mean, there's something so fundamental to this idea of being a tribe, being a unit, being more than just a singular self. And I think that as people have left the traditional synagogue or the traditional avenues of where Judaism was expressed as a group and have tried to substitute that, or sometimes go to another group, or sometimes go off individually, the idea of group psychedelics can really take us back to our roots of community, of group, of why we need and rely on one another. You know, there's another saying, let's talk Jewish things, that Hillel says, Lo alecha hamlacha ligmor. It is not upon you, the individual, to do all the work. It's really about that you're part of something. And I believe that alienation and feeling alienated from others in society is really at the core of a lot of people's suffering, and just the connection. It happens so fast in a transpersonal state. It's so efficient, and it happens so deeply, and it happens in a way that is so unforgettable and transformative, that it's really worth holding the value of this and working very, very hard to get this as something that would be broadly available, and have attitudes about this be, you know, changed from this cookie scary thing, or crazy hippie thing, or maybe dangerous thing, to something that might actually promote something that is more positive. It's not just tikkun olam, but it's tikkun of the individual within the context of their greater community. And one of the most important groups to not overlook is the group of your family, and just the way that perhaps there can be, I would be very excited in a study that would examine doing psychedelics in the context of family therapy. We're not going to take that on, but I can't wait to hear about it from others who do.
I think that's a really beautiful place for us to close. You know, all progress is return to our own hearts, return to our own holy lands of our own bodies in a good way. I'm aware that this is like a very juicy conversation, and the first Jewish Psychedelic Summit. I look forward to more. And thank you everyone for participating, for sharing your wisdom, your expertise, and your questions. I wish we could answer all of them. So thank you. And any final words? I'm open to it. We got 2 more minutes.
I would like to add a final word, if that's okay. I don't need to have the last word, but something that I'm also just aware of is how to maintain some sort of like guardianship of the sacred in this space, both with the fear of psilocybin becoming medicalized, and also just like the profit and investment and potential colonialism that's happening just like within the market of psilocybin. So a question that's coming up is how to do this work or hold the space of group work with the sacred, or some sort of like holding of the sacred in mind. And then also, where did this plant come from? Who has shared it with us. Where are we like getting it from, and keeping that in the conversation as well. Where are we inheriting this technology and intelligence, and who has safeguarded it for us? Which people?
It brings it back to the family and who's been stewarding, and how do we be in reverence and connection in a way that's good and honest. Thank you, everybody.